Hi everyone, welcome to the Ask Giri the Physio Show, episode 13 of season 2. Today we're going to discuss few things about long COVID physio. Long COVID is the new terminology for some of you might be, we post-COVID rehab, we talked about last season. I think we did an episode on post-COVID rehab. If you haven't watched that, go to physioshow.ca, watch that episode, then come and watch this one, because after that episode, there's a lot of new information was coming out, a lot of new research, a lot of new data was coming out. So I based this small presentation based on the new data we have about long COVID physio or post-COVID rehabilitation. So we do have patients, most of them are WCB patients actually right now. We are treating with long COVID or post-COVID syndrome. They present with so many different symptoms. The management is a little bit different than how we manage other people. So I want to explain that experience with those people and help the people out there who might be suffering from some symptoms and not sure what to do about it and where to go for help. So that's the whole purpose of this episode. So what is long COVID? Basically, your post-COVID symptoms is presenting with you for more than 12 weeks after your COVID resolved, in your body. So that's called long COVID symptoms. So you should have the symptoms for 12 weeks continuously. It can be various symptoms. We can discuss about that later. So 1 in 10 of all cases who had COVID will end up in long COVID. Accordingly, local statistics in Alberta, I hear there's about 8,000 people with long COVID right now and who needs physiotherapy treatments. And also, this is a multi-system disease. We have patients who are musculoskeletal system involved, neurological system involved, and lymphatic system involved, cardiopulmonary system involved, respiratory system involved. So it's a multiple system disease. So when we do an assessment, we do multi-system assessment to make sure that everything is taken care of before we put a proper treatment plan out there. So that's where a physiotherapist comes in handy for you to be well versed in musculoskeletal, neurological, cardiorespiratory field. Because a lot of people don't know that physiotherapist role in cardiorespiratory diseases. That's quite vast actually. And also, WHO listed 200 symptoms for the long COVID patients. So you can have any combinations of those 200 symptoms, right? And my average COVID patient here in the clinic would have at least 10 to 15 symptoms. So you can have any mix of those 200 symptoms we'll have. And sometimes you can have very unpredictable pattern of flare-ups and remissions with these diseases. You might have a couple of good days, you thought you're all good now, and boom, one day you'll have a bad one. Like you might have a lot of brain fog or dizziness or extreme fatigue and whatever can happen. So when it happens like that, it's very normal way this disease kind of explains itself, So don't get discouraged when it happens because that's the way it goes. But your physiotherapist is there to help you through the recovery process. So what are the most common symptoms? The top 3, I put it on the top there. Those are the top 3: extreme exhaustion or fatigue. That's number 1. Okay, and I treat people tele-rehab and also in the clinic, and that's number 1. Even the normal activities, what they do, they can't do because they get very tired. And the other one, it might be a new term for you. It's called PESE, P-E-S-E, PESE, post-exertional symptom exacerbation, right? So you do any kind of exertion activity, so immediately your symptoms come back, right? And then problems with your memory and concentration, like fog, brain fog, right? This can happen when you have your concussion also sometimes, right? So these are the most common symptoms of long COVID or the post-COVID syndrome. What are the other common symptoms we see with the patients? Shortness of breath, right? And you're just a small activity, a flight of stairs or walking about for 5 minutes, you'll get a lot of shortness of breath or dyspnea, right? We measure this with the dyspnea scale, and also we'll see, we call RPE scale, rate of perceived exertion. We actually give the printouts for the patient to kind of track themselves, how much exerted they are before the activity, during the activity, and after the activity. That really helps the physiotherapists and your healthcare practitioners to provide a treatment plan for you. Chest pain or tightness, dizziness. Right, dizziness can come because of various reasons. A lot of this post-COVID patients, we have a lot of neck issues, neck stiffness and neck pain. So sometimes dizziness can come from there, right? Dizziness can come from the brain also. So we have to check where it's coming from and treat accordingly. Muscle and joint pain, That's our bread and butter, you know that, right? And it can be generalized or it can be specific. I have patients who have whole left side is affected, right? Left side face, jaw, neck, shoulder, spine, lower back, hip and ankle, all on the left side. We have to figure that out. And some people only have back pain, some people only have neck pain, some people have multi-joint pain. So you can have any one of those presentations for this condition. And depression and anxiety, because you don't know why I'm getting all these symptoms, why it's staying so long, why one day I'm good, why one day I'm bad, what should I do about it? It's confusion, brain fog. It's hard to explain to people what's happening to you. So that's why you can get depressed and anxiety. So that's when we bring our other colleagues into the team, our psychologists, right? They come into play, right? And our social workers come into play. Our occupational therapists come into play. And actually, Workmen's Compensation Board in Alberta is doing a great job with their COVID team. The case managers are very understanding, and then they put a physios, they put OTs, psychologists, they put everybody in the team so that the long COVID patients, WCB patients are getting very good care. I'm very, very proud of that organization, the way they're handling this COVID patients actually. Kudos to WCB in Alberta. Next, cough, headaches and sore throat, right? And I have a patient even 3 months after, she still has cough with secretions, right? It can happen. So it takes more time to resolve. And headaches, because of the pressure variations and so many neck issues also can give you headaches, and stress can give you headaches. Sore throat, not very commonly I see sore throat, but some people do have sore throat, right? Tinnitus and earaches. I only have one patient with tinnitus, not such a common symptom. Loss of appetite, diarrhea, not such a common symptom based on my experience with the long COVID patients, but some people it might be different. So do not forget the top three: fatigue, peace, post-exertional symptom exacerbation, problems in memory and concentration, brain fog. So that's when we involve people in cognitive rehab, right? OTs come in, psychologists come in, brain games come in. Our cognitive rehab channels are opening up for those people. Fatigue, number one. So this fatigue is not very easily relieved by when you rest or sleep, right? And also your usual activity can cause more fatigue. It does not have to do any very strenuous activity to become fatigue. Your normal walk, your normal gardening, your normal flight of stairs can cause you extreme fatigue. And it will affect your functional day-to-day life activities and also impacts your quality of life, isn't it? Hope everybody's with me so far. We'll move on to the piece, the post-exertional symptom exacerbation. So this is very distressing, this one, okay? Sometimes people call it as a crash. I just crashed today because I just did small mild gardening, then I'm done. I couldn't do anything else after that day. So sometimes it can be triggered by any kind of physical activity or exercises. That's why when we are creating exercises for our long COVID patients, we have to be very careful. How much can they do? How much, when they should know when they should stop the exercises also, right? Symptoms will worsen 12 to 48 hours after you finish the activities, and it can last for days and weeks and even months. So that's how this post-COVID thing reacts. So when you do an activity, you will know the symptoms are kind of coming on. You should identify that and stop that activity. Otherwise, you would crash, right? What are the activities? It can be any daily activities. You're cooking and vegetables, cutting, whatever it is, walking, reading, writing, and even like high sensitive environment, like, too much light, too much sound, all those things can affect it. So that's a small kind of a glimpse for you about the post-exertional symptom exacerbation. So how to manage this as a patient? If you have this, how to manage that? Pacing, activity pacing is very, very important, right? Pace your daily activities, including your cognitive activities. How much time you're spending on the screen? How much time are you reading, right? How much time you're on the telephone speaking to somebody? That's also cognitive work. You got to pace that also. So you have to be very, very careful about that. And stop trying to push your limits. As I told you, one day you'll feel really good, and then you try to do too much. Then you're going to pay for it for the next few days. So learn your limits and don't push it too much. And the rest is a good management strategy for this condition. Actually, don't underestimate the value of rest. And some of the symptoms of that piece also mimics the symptoms of your myalgic encephalomyelitis and also chronic fatigue syndrome. And there is some kind of a blending of symptoms with this, with the long COVID patients as well. Just want to put it out there. So how to use pacing? What you can do as a long COVID patient or things like that. First of all, if you haven't taken any help, please take some help. You need help with your healthcare practitioner and the physical therapist. So first of all, you should know your energy reserve and your energy, how much you have. I always tell my patient, imagine when you wake up in the morning, you have full tank of gas, 100%, right? And throughout the day, your gas is going down as you do different things. So you should know when you reach your 80% capacity, 80% gas you spent already, and that's where you stop for the day. Do not empty your tank. If you empty your tank, you're going to cause the PESC, and then you're going to have symptoms exacerbated for a while. Then you might crash. So don't go into that. Stop at 80% of your fuel capacity, right? And also 4 P's, which is help you. So this content, some of the content is actually World Physiotherapy 2021, World PT Day 2021. They put out some of this information for to educate the public, and World Physiotherapy has decided this year it's going to dedicate the World PT Day for long COVID rehabilitation. That's what they've decided, and along with the WHO, they came up with a lot of content to help the people, and these are some of the content I have used here from the World Physiotherapy and also from the WHO, so to kind of help you guys with those ideas and pamphlets, right? So prioritize what you have to do that particular day. Don't take too much on your plate, and plan the activity. When you plan the activity, make sure there is rest is also included in your plan, right? So give some time for the rest and then plan your activity. Again, don't empty your fuel tank. Pacing, right? Learn to say no. Like if that activity can be delegated with somebody else, you can do it. Or any big activity, just break down into small components. Just do 2 components today and 2 components you can do tomorrow. Try not to take too much and do everything at once. Stop pushing your limits, okay? And pleasure, do something which is also gives you some fun, right? Small things which gives you fun. That really helps you with your depression and anxiety and changes the mood. It switches from your sympathetic to the parasympathetic nervous system. It helps in so much ways. And don't forget to breathe nicely. So those are the 4 P's which will help you to plan your activities. Prioritize, plan, pace, and do something which is pleasureful, right? And also learn how to save energy, right? And certain things you can delegate it, right? Gardening, instead of doing everything on one day, 3 days, split it up. And also rest is the best treatment modality for this. So rest between activities, and make sure explain the condition to your family members, educate them, then so that they understand what you're going through, and they will know when you're resting, they know why you're resting, right? That's important for it. Rehabilitation. When it comes to rehabilitation, a good team, your physician, your pulmonologist, or your physiotherapist, your chiropractor, your occupational therapist, your psychologist, social worker, vocational counselor, WCB case manager, or any case manager, your employer, we are all involved in your rehab. We are there to make sure that we understand your condition, we know how it works, we know how long it takes, and we wanted to help you to recover so that you can return to work or return to sport or return to whatever you love to do in a nice way, right? And also being a healthy individual, we help you with that. As I already told you, physiotherapist is a health coach. We just don't heal tissues. We are your health coach, right? So safe and effective rehab is a fundamental part of the recovery, because with this condition, there's a lot of vital signs variations happens, especially the heart rate and oxygen saturation. So we make sure we monitor that all the time, blood pressure, heart rate, oxygen saturation before, during and after exercises. Then we alter the dosage according to that, dosage of your exercises according to that. And it has to be goal oriented and tailored to the individual. Whatever your return to work or return to sport or return to activity goal, we'll work with that. Everybody job demands and work demands and sports demands and physical demands and cognitive demands are different. We work with that, your goal, and we'll teach you how to activity pacing should be done, and we monitor the heart rate regularly. We make sure we keep it below 15 beats per minute so that it calms down. And also there is heart rate variability calculation. I actually described more in the previous presentation about post-COVID rehab last season. You can go to physioshow.ca, review that for 20 minutes, and it'll make more sense for you, and you can gain more knowledge about it. And a lot of respiratory muscle retraining, like starting with breathing exercises, different types of breathing exercises, and then also we use breather for a lot of respiratory muscle training, and a lot of other exercises we do, right? Breathing exercises obviously is the prime most important, because a lot of abnormal breathing patterns we catch with the post-COVID and we make sure that we teach everybody proper diaphragmatic breathing exercises, and also very mild and graded exposure to exertion. And that's not applicable to all the time. Sometimes when you have very severe PAC, we don't do a lot of graded exercise therapy. We modify that protocol and the dosage, but otherwise we expose you to kind of stress slowly so your body can accommodate and train. Functional retraining based on your goals. Work conditioning based on your job demands, whether you have a desk job or your industries or you're working in the oil field or you're a carpenter, whatever your thing is, we know your demands and we train you accordingly and make sure your breathing and heart rate and oxygen saturation is keeping up for the training. And then track your progress. Like what you can't track, you can't measure. What you can't measure, you can't improve, right? So we make sure that we have, I will kind of design a COVID package for my patients actually. What are the outcome measures we use? We put it all together so that we make sure we kind of take care of your outcome measures, which is shortness of breath or exertion or breathing, or we call it modified fatigue impact scale. So we have a tool to measure everything, most of the common symptoms, so that we track that score. We have a baseline score, then we see how you are improving and we make sure that goes up as well. So this is how we approach a long COVID or a post-COVID patient. So if you have symptoms, do not wait. Please take help with your physiotherapist who experienced in long COVID or post-COVID rehab. We are here to help. So don't wait any longer. Hope this information was helpful. And if you have friends and family who are suffering from some of these symptoms, please forward this information to them so they can be educated and empowered and they can take some help as well. So that's the whole point of this presentation. I know we are a lot of people out there who needs help with this condition at this stage of the era we live in. So we are here to help. So we'll see you guys next time in end of July. I think we're going to do something about golf. Okay, see you then. Bye. Have a nice day.